Hello, my name is Napir Sharif, and I just wanted to start off this video by first thanking you for watching my submission, and thanking you for allowing me to participate in such a prestigious scholarship opportunity, and to have attended the Congress this past November. All the speakers were so amazing and so inspirational. But I have to say, for me, Jack and Draco was the most inspirational. His test for pancreatic cancer was so different, so extraordinary, so creative, so innovative, so much better than our standard test methods. Like, Jack is an extraordinary example of what the minds and the dedication of young people can truly do. And as I sat in the audience and I listened to him speak, I thought, man, if this kid can do something so amazing at only 16, then so can I. Since leaving the Congress, I've really thought about my life and my future goals, and I've made it my life goal to make a difference in the medical community, even if that difference is only a small one. And me participating in this scholarship challenge is my first step in making that difference. Similar to Jack, cancer has also impacted the lives of those around me. At age 11, my friend Ashley was diagnosed with stage 4 Hodgkin's lymphoma. Hodgkin lymphoma is a cancer of lymphocytes, also known as white blood cells, and is most common in people between the ages of 15 and 44 and those over the age of 55. Each year in the U.S., about 10,380 children are diagnosed with cancer, and about 3% of these cases are caused by Hodgkin's lymphoma. Over the years, we've developed treatment methods such as chemotherapy and radiation and bone marrow transplants. And with these treatments, we have increased the survival rate to 80% for 5 or more years, which is extraordinary. However, even though these treatments do what they're supposed to do when they kill off these cancer cells, they also kill off the healthy cells. And those people who survive these treatments are obliged to a lifetime of frequent medical checkups and a slew of horrific side effects. With these side effects including things such as heart and lung problems, delayed growth rate, infertility, learning problems, and even more terrifying, an increased risk of cancer that is 2 to 3 times greater than that of the general population. It seems like those people who defeat this daunting task of surviving cancer are forced to live with a decreased quality of life. I see my friend Ashley being affected by some of these side effects every day. From her treatment, she's developed neuropathy and asthma and memory loss. And it's not uncommon for her to miss a week or even a week and a half of school. She defeated this overwhelming feat of beating cancer, yet she's still forced to suffer through these everyday trials and setbacks. And it seems like she's unable to live the same happy, quality life that these people who never had cancer get to live. I believe there's a way to treat cancers like Hodgkin's lymphoma and avoid the slew of horrific side effects. With the aid of antibodies and normal lymphocytes in the body, we should be able to destroy these cancer cells without destroying the normal cells, and therefore not have these patients suffer from these side effects. Reed-Sternberg cells are the defining cells of Hodgkin lymphoma. They are most often large, dinucleated, mutated B cells. And like all cancer cells, these Reed-Sternberg cells are constantly in the mitotic phase of cell division, and therefore they are constantly dividing and do not perform their function. Because B cells are key in the body's humoral immune response, the presence of these Reed-Sternberg cells greatly weakens the body's immune system. When functioning normally, B cells are able to recognize and present foreign molecules in the body, also known as antigens. And in order to defeat or kill these antigens, B cells must go through a process called hypermutation. During hypermutation, B cells present the antigens, and then they are then activated by another type of white blood cell called a helper T cell. Once activated by these helper T cells, B cells begin to proliferate, also known as colony expansion. And during this colony expansion process, an enzyme called AID introduces point mutations in the B cell DNA region that codes for antibodies. The result of hypermutation is the production of antibodies with an increased affinity for the antigen that was presented. Reed-Sternberg cells, however, do not go through this process, and therefore they are not able to produce adequate antibodies to defend against antigens within the body. Not only do they not produce antibodies, but Reed-Sternberg cells also release cytokines or chemical messages that suppress the body's other immune responses. Because Reed-Sternberg cells are derived from mutated B cells, there's a discrepancy in their surface proteins. For example, the CD20 protein, which is found on the surfaces of a vast number of normal B cells, is not present on Reed-Sternberg cells. The surface protein essential for my proposed solution is the CD15 protein. This protein, also known as Lewis X, is present in almost all Reed-Sternberg cells, even its rare variants. The original function of this protein is the adhesion and the migration of pre-implanted embryos. Therefore, once stem cells have been differentiated and an individual has been born, it is no longer essential for the normal functioning of the body. This Lewis X protein is often used as an identification marker for Reed-Sternberg cells when patients are being diagnosed with Hodgkin lymphoma. I believe we should treat this CD15 protein as an antigen and then create antibodies which can be injected into the blood and used to agglutinate or clump together these Reed-Sternberg cells. The presence of these antibodies would stimulate macrophages and other phagocytic cells to destroy these clumps. And not only that, Reed-Sternberg cells spread throughout the body by traveling lymph node to lymph node. By agglutinating these cells, we are able to stop their movement and provide these phagocytic cells more time to destroy them. Natural killer cells are another type of lymphocyte. These cells kill cancer cells and tumor-causing cells through the use of cytokines which promote apoptosis or programmed cell death. Recently, researchers have discovered that an MYSM1 enzyme is key in the production of these natural killer cells. Not only does this enzyme help to mature these natural killer cells, but it also increases the number of natural killer cells in the body. By using this MYSM1 enzyme and antibodies, we should be able to identify, tag, and destroy these cancerous cells in the body. Rarely, and very late in the disease, Reed-Sternberg cells can invade the bloodstream. Under this condition, antibodies could not be injected directly into the blood due to the alarming possibility of causing blood clots. However, using a system of filtration similar to that of dialysis, cancer cells should be able to be filtered out of the patient's body. So in dialysis, blood is pumped from an artery through a system of tubing, which allows the unwanted molecules to diffuse out of the blood, and the needed substances are able to be pumped back into the body with the clean blood. So using this concept, the blood would be pumped out of a patient's artery and through a system of tubing and filters that are lined with antibodies for this CD15 protein. And these cells, these Reed-Sternberg cells, would be attracted to these antibodies, allowing the clean blood and the normal cells to pass through this filtration system. This clean blood can then be pumped back into the patient's body, and this would not harm or cause damage to any of the healthy cells. And then after filtering these cancer cells out of their blood, they could then be treated with the antibody and the enzyme treatment, which would then kill off the remaining cancerous cells within their lymph nodes. By doing this process, none of the healthy cells are damaged, and therefore these patients would not suffer from the terrifying side effects that are caused by traditional treatments. In conclusion, if my treatment method works, then it can be used to treat other forms of lymphoma. By identifying these key surface proteins on these cancerous cells, antibodies can be created to agglutinate these cells so they're destroyed by other phagocytic cells, or so they can be filtered out of the bloodstream. With either of these processes, healthy cells are not killed, and therefore you would not have many, if any, of these side effects that are caused by traditional treatment. So, my name is Napir Sharif, and thank you for watching my video submission for the 2015 Scholarship Challenge.